Hello, everyone, and welcome to RevMD Sex Bites Podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golembieski here, nurse practitioner with Revitalize MD, and today we have a interesting topic, one that has kind of come up organically in conversations. Most of our podcasts come from patient questions or just topics that we want to talk about that we're passionate about. And every once in a while, we get one like this,
where it might come up as a conversation with a patient, a family member, friend, all of that. So yeah, this one's an interesting. So it's a supplement called Pygeum, and it, again, does size matter? And does load matter? So this was an interesting topic brought up, saying that orgasmic strength might be related to the
volume of seminal fluid, yes, or semen or load or cum or whatever word you want to tack on to the end of that.
Yes. So the volume of your ejaculate, your cum. Yes. There's so many different words. But so the bottom line, does that matter? And so Pygeum kind of came up as a supplement that somebody was using to increase volume with ejaculation and whether that worked or not. So we did a little research into it.
Exactly. And so it was very popular on Reddit. It was really popular on some of these testosterone websites, but it was a conversation of, well, if we have decreased, this was a male talking, if we have decreased ejaculate or semen or load, cum, whatever, volume, then we have weaker orgasms. And my question I posed back was, well, does it really matter? Because it's a pulse, like for women too. It's a muscular contraction that leads to that feel-good sensation, that climax. And I'm like, if you're still having those pulses, does it really matter if anything comes out or not? Because to me, it doesn't make sense. Why should it matter?
Yeah.
You should still feel good.
And there's even like retrograde, and there's still again, it's known to decrease volume. Like your volume is going to decrease over time and with age.
Yeah.
And so, it is known that orgasmic strength decreases with time as well, and sensitivity, but are they related directly to each other? And then some men will have retrograde ejaculation, so a decreased volume that actually comes out that's visible. And do they have weaker orgasms? So it's just a very interesting topic.
One I've never thought of. Yes. I don't have the equipment. I don't know.
Which brings us to the point that if you've used this supplement, or if you agree or disagree or have input, then leave your comments, because again, we don't have the equipment. So we can't comment from that standpoint. And so we would love to hear feedback, and then we'll go into what we found, which is relatively equivocal, actually.
Yep. Yeah. It was actually really interesting. So can you only imagine what my Google search history looks like this week?
Yes.
When preparing for this podcast.
Or ever, really.
Really, yeah. I guess that's right. But this one particularly.
Yes.
So Pygeum is a name for extracts, teas, supplements that come from a bark of a tree that's native to Africa. I might completely slaughter this, but it's Perunus africana, but pretty much it's this bark that's used as a supplement. And when you Google, because some of you will be doing that as soon as you hear this, when you Google Pygeum, it's Pygeum, what comes up is that it's great for reducing the enlarged prostates, or for benign prostate hyperplasia, BPH. So an enlarged prostate. There's also a lot on there about helping with urinary symptoms. So helping those that have a decreased urinary flow, urinary frequency, or trouble completely emptying a bladder after urination. So where you have storage and retention. And that's what comes up. So I'm like, okay, well, let me keep looking. And it's not freely put out there. And then all of a sudden on this one side, it's like, oh, and it can help with increased libido and increased seminal fluid. Done. One sentence. I'm like, well, that's not helpful.
Well, and again, so when it talks about shrinking prostate, any medication that you use that decreases the prostate could potentially increase seminal fluid. And so we started talking about, again, like the different phases of men and orgasm and ejaculation and what happens. So it would make sense that if it's shrinking the prostate, and with an enlarged one, you just get less function, that you could potentially get increased volume, because a lot of the actual, well, not a lot of, so when we're talking about ejaculate, or cum, you're talking about 75% of it being seminal fluid and only 25% of it being prostatic fluid. So if it's coming from the prostate and now you're functioning better and getting more. So it kind of makes sense to me that would happen. But again, it's kind of equivocal in what we did find, which is very limited. But interesting.
But interesting.
Yeah.
Yes. Mm-hmm. So then, because my brain is curious, I look it up and I start looking at reviews. So even on these websites for the supplements, it is unbelievable how many men have commented about, it helped my prostate, but it also increased my load. It's helped my orgasm strength. It has helped with pre-cum. It has helped with, it is just over and over and over again. On Amazon, we pulled it up before. There's over 2,100 reviews, and the majority of those have nothing to do really with necessarily guys that were looking for prostate issues. It is all about increasing load volume. One was like, it'll have you shooting like Old Faithful and throwing ropes like a cowboy. It was hilarious. I was dying. And this all came across all because of one conversation about a gentleman that said, since I've been on testosterone and my volume, my semen volume has decreased, and I feel like it's making my orgasms weak. So this is how we get here to looking up and reading Amazon reviews.
Yeah.
And
correct.
Supplement reviews.
So it's very interesting because, again, feedback. So sometimes there aren't studies that support a lot of things. Supplements aren't fully regulated. But again, you can get safe supplements. That's not the issue, but going to a place where you actually trust, that are getting good quality supplements. But a lot of times there aren't studies that you're going to depend on because it hasn't been looked at like that. So getting feedback from patients or people that are actually using it is very helpful. Exactly. And we were surprised to see all the overflowingly positive reviews on it. So
I couldn't believe it. It was the most common are increased pre-cum, increased load volume, increased recovery after sex, like quick turnover time. That refractory period we've talked about for women is the same for men, and decreasing that, then increasing libido. And it was shocking.
Yes. Yeah.
So then when you start actually looking at studies as far back as like Masters and Johnson, which is back in their first study, I wrote it down, was 1989 that looked at it. They were like, absolutely. Volume and orgasm go hand in hand. But then you look at the last 15 years and start pulling those studies, because now we're not looking at Pygeum. Now we're looking, is there a correlation between load volume and orgasm strength? They say, no, it doesn't matter, which is interesting.
Well, and again, Masters and Johnson, though, did probably the most objective studies. I don't think that they've been able to compare with a 12-year period of studying, orgasms in the lab with objective numbers, videos, measurements. So, we again did a podcast on the sexual response by Masters and Johnson and Orgasmic, and it actually talked a little. I mean, it's men and women too, but they did a lot again on men and orgasms for men. And so if you look at, orgasm for men versus, there's phases. So emission is one of them, where you're actually getting fluid from the different organs. So it's prostatic, it's seminal fluid, it's
that collection at the base of the penis.
Yes. So it's collecting, and it's almost inevitable. Bulb. It's inevitable that it's going to happen at that point.
Yeah.
And then ejaculation is actually the muscular contraction pelvic floor, or the muscular contraction at the base of the penis again.
That is then pushing that fluid up and out of the penis. So that force in which it is ejaculated out. So that is expulsion or ejaculation phase. Yes. So again, there's phases, Masters and Johnson says there's 2. Now, there's other research that shows there's really 3. There's like she said, the emissions, the buildup, the expulsion or ejaculate, that actual act of the fluid coming out. And then the third being the orgasm.
The orgasm. And so it's interesting every time you read about this stuff because you learn so much and it seems so simple, but then it really is more complex. And this is a perfect example of, ejaculatory volume, directly correlating with, and I would think that Masters and Johnson still has the most objective data on that.
Yeah.
And then again, so when you're combining the fluids from the different organs, that's, the emission phase and then ejaculatory phase, muscular, but the bulbo cavernous muscle too. And so the more strength that you have with all of that, and that's at the base, the better, at least the force.
The force is better. Yeah. And they say that, there was a urologist that we were reading a blog on that says, that force does make a difference and that it feels better. And that's kind of what Masters and Johnson said. They said that the more seminal volume ejaculated, the greater subjective sensation of pleasure across the board.
And they had the most comprehensive data that they gathered over a 12-year period, recorded people having sex, measured things, intravaginal measurements, volume. It really was quite a collection. So I think that probably is, what I would go with. And then again, but if you look at reviews, it's consistent with that. Yeah. So not only do the reviews say it's increased volume, but the sensation, orgasmic strength. There were a couple that even talked about better erection quality, So again, all of it looks to be pretty positive. Downsides of it, again, there was some palpitations that could happen.
Rapid heart rate. So again, with any supplementation, you want to follow the directions on the bottle. Don't go onto Reddit or TikTok or testosterone type of forum, men's forum, and see that someone's doing 3 times the amount, so it must be better. Let's try that. Follow the guidelines. If you don't feel good on a supplement, stop it. Not all supplements are created equal, so definitely making sure you're getting a good quality. I mean, like I said, I went on Amazon, and the first one that popped up had like 2,100 reviews. And I mean, is it the best quality? I don't know, but it sure was the best reviewed one.
Yes. Yeah, correct. Well, and again, if ultimately the big thing with Pygeum, to simplify it, is it's supposed to shrink your prostate, so your prostate will function better. So you're getting more symptoms. And help with urinary symptoms, and then increased ejaculation. So or volume. So those are the 2 big things that it's said to do, is decrease. So it's used for prostate health, decreasing the size, therefore, better function and increasing ejaculate volume. Those were the 2 big things. If you're decreasing the prostate, no matter what, you're going to get better urinary symptoms. So any medicine that decreases could potentially increase volume. But for a supplement, those are medicines. All medicines have side effects. This is a supplement you can get over the counter with great reviews. And again, I think some science that really does support it.
Exactly.
And a lot of subjective positivity related to this supplement. So if you can increase your urinary symptoms, prostate health, and orgasmic strength with a supplement, then I think this is a great option.
Yeah. And then fast forward a month, I had a conversation with that same guy and said, so what happened? He goes, it increased volume and my orgasms are more intense. And I'm like, come on, really? And that's why we're here.
Yeah, exactly.
Because I don't know.
Yes. Well, so definitely we want to hear feedback. So if anybody has used it and wants to provide some comments and feedback, we would love to hear it. Or if you end up using it and then you want to provide some feedback, that's a great addition to, again, the podcast and finding out what works and what doesn't and what everybody's thinking. And then there was another interesting thing, because again, if there's 3 phases, emission being one of them, ejaculation, and then orgasm, it was also in the reading that we saw that orgasm is more in the brain, emission and ejaculation are in the penis. And again, we don't have the equipment to say whether that's the case or not, but it seems to me like they're not so separate. And so we would love to hear about that. But I think that really more specifically, if somebody agreed with that because I think across the board that's probably a hard one too.
Yeah. I mean, really, guys?
Yeah.
I don't know. It was funny because it was posed as like big head versus little head.
Orgasm.
Ejaculation is penis, orgasm is brain, so that there is this emotional response, but that happens in the brain and it's connected to the act, but separate.
Yes. Yeah.
Which is hard for me to wrap my head around too.
Yeah. Yeah.
I don't. All the guys I talk to, I don't think would agree with that statement, but who knows?
Yeah. So we look forward to hearing any comments or feedback. And again, anything else you might want to hear about, and let us know. We're willing to deep dive into anything, obviously.
Well,
sexual wellness.
Kegels. That was like across the board. Everyone said men do Kegels. Tighten your pelvic floor. It'll help your orgasms. There's a pro tip for you.
Yeah, exactly. There you go. That's the ejaculatory part. The muscular
that muscular.
Yeah.
So,
and if that's a simple thing you can improve, yes.
Yeah.
Awesome. So, all right, let us know if there's anything else you want to hear about. We're willing to deep dive into anything sexual wellness. We are here to revitalize your look, your health, and your sex life. And definitely like, subscribe, share with friends.
leave us comments. Thank you.
Thank you.